Hey there, welcome back to The Empowered Edge, the podcast where we unlock your best self through optimal health, a resilient mindset, and lasting habits. I'm your host, Jenna Hostetler, and today we're tackling a topic that is the determining factor to improving your health and eliminating disease. What does healthy really mean? It's easy to get caught up in what is trending, whether it's organic labels, keto snacks, or the newest superfood everyone's talking about. But healthy means different things depending on what you're measuring. Your version of health could be vastly different than someone else, depending on your goals and your priorities. In today's episode, we're going to break down what it means to be healthy so that you can make choices that support your personal goals, even if they contradict what others think you should be doing. If you have ever felt overwhelmed by the conflicting messages about what's healthy and what's not, this episode is for you. Let's dive in. Okay, so what does healthy really even mean? Let's start by looking at the dictionary definitions of health because they reveal some interesting thoughts and it's worth discussing. So the first definition is enjoying good health. If you're in good health as far as you know, but you are not enjoying life, what's the point? Are you enjoying your health right now? Are you in good health and are you actually enjoying it? Maybe you're free of disease and in good shape, but are you constantly stressed because of things that you think you should be doing but aren't? Or because you've given yourself unobtainable standards that you will never meet? Are you depriving yourself of things that you enjoy, thinking that you need to sacrifice happiness to maintain your health? Because if so, what's the cost? And is it worth it? Do you struggle with guilt because you feel bad for not being happy when the mirror and the scale say you should be? Or do you feel anxiety because you feel like everything you want you can't have and everything you need to do you don't like? Even if you've reached your health goals, if you're not enjoying life or your good health, can you really say that you're living a healthy life? Because I don't think so. And more importantly, can you sustain this kind of health and lifestyle for the next 40 or more years? See, these are the kind of questions that we need to ask ourselves to truly understand what health means for us. See, being healthy is extremely important to me for a lot of reasons, but I still have my limits of what I'm willing to do. And some days or in some situations, I just don't care. If you go with me to a fair, there is an 85% chance you will see me eating a funnel cake and enjoying every bit of that crispy, melty goodness with powdered sugar falling all over my face. I will eat it with joy and I will not for 1 second feel like a hypocrite. Because I feel, and I believe most people feel this way too, that good health should not hijack your life. It should enhance it. It should make it better. And while it's true that I don't eat that way very often, like hardly ever, because I just generally don't want it, when I want it, I allow myself to have it precisely because I hardly ever want it. Now that in itself is a whole other conversation to have, but it is worth having. But for now, the point is, don't allow the desire to be perfectly healthy take the joy out of life, because then you're not enjoying good health. And what's the point? Definition number 2 is not displaying clinical signs of disease or infection. Now that sounds pretty straightforward, but this is actually kind of a problem. Because just because you're not showing symptoms doesn't mean that you're healthy. It doesn't mean you're in the clear. You could be headed down the path of heart attack, stroke, diabetes, autoimmune disease, or any number of other serious conditions and have no idea it's looming, that it's right there until it's full-blown there. You could be headed down that path and have no idea. And if you don't go to the doctor, if you don't get regular checkups, or if you don't get blood work done, you might be blissfully unaware of how your numbers are, of what they look like. Things like your hormones, your vitamins and minerals, your cholesterol, your blood sugar, and your insulin, they could all be way out of balance, and you have no idea, possibly for years, that they're so bad. So not feeling unhealthy and not having negative reports doesn't mean that you're in good health. Now, on the other hand, if you go to the doctor regularly and if you get blood work done, you can still be blissfully unaware of how off your numbers are, because there can be a huge gap between what's considered normal and what your body actually needs to thrive. For example, your vitamin D levels could be normal according to standard testing, but maybe it's only half of what your body actually needs to have a strong immune system. So your doctor will tell you that you're all good and you're fine and you don't need a vitamin D supplement, all is well, but really you need massive supplementation or the next time COVID comes around, you're going to get it. You might have elevated cholesterol and your doctor wastes no time in sending over a prescription of statins to your pharmacy, but in reality, you're totally fine, your high cholesterol is not a problem, and those statins will probably cause more harm than good. And isn't that interesting, how the medical industry is so quick to assume that your nutrition is fine, and they're even quicker to find a reason for a prescription. Now, I'm not saying anything here. I'm just a friendly observation that my cholesterol and my A1C got checked way more often than anything else. And you can say that it's because insurance pays for those tests, fine, but there's nothing stopping a medical professional from providing other recommendations, because I'm pretty sure that doctors' offices and labs accept credit cards. So the bottom line here is, with this definition, clinical signs of disease or a lack thereof can be a total lifesaver or they can be absolutely meaningless. So unfortunately, you get to do your homework and figure out what your numbers mean and what you need and find a doctor who actually knows what they're talking about. Okay, definition number 3. Beneficial to one's physical, mental, or emotional state. Now this definition brings us back to your priorities. What does healthy mean to you and what are you willing to do to get there? Now that phrase, that question, what are you willing to do to get there? It means you can take it 2 ways. Number 1 is, what are you willing to do to get the results you want? Are you really willing to do what it takes, or are you willing to do what's easy, what's comfortable, and you get what you get? The other side of that is, how far are you wanting to go? How far are you okay going to be healthy? Are you willing to let it destroy your life? Are you willing to become obsessed so that you can say that you're in great health and that you're unstoppable and that you are like this unbreakable human or something? Because if you become stressed about everything you do, every time you start a new diet, or every time you go to a restaurant, that's a problem. If you feel anxious when you get together with friends because you're surrounded by foods and drinks that you think you shouldn't be having, that's a problem. And if you have this constant internal conflict between what you think you should be doing and what you really want to do, that is a problem. Mental health and emotional health affect your physical health, so being in control of your stress, your anxiety, your anger, of all those emotions is as important as being in control of what you put in your body. It's also important to recognize that you can be physically healthy while having an unhealthy relationship with health. Whether that's food, exercise, or something else, or some combination of all of them, health is so much more than just the food that we eat or how much we work out. There's an eating disorder called orthorexia, and when I learned about this in my internship, I immediately thought of a few people, and maybe you will too. Orthorexia is defined as an obsession with proper or healthful eating. Anything good and anything good for us can become a problem when we let it get too far. And this is what I'm talking about with the definition of health. Either becoming so obsessed with everything you consume that it takes over your life, or your relationships, or the people around you, or you think that you need to be so incredibly strict that you make yourself crazy and miserable, and everybody around you is miserable too. You do have to ask yourself if it's worth it, and this is generally when people burn out, because they went too far. Now, why would I dedicate an entire episode defining what it means to be healthy? Because you cannot pursue a goal that has not been defined. Just like last week when we discussed value-driven goals, it is crucial to understand what you truly want when it comes to your health. People around you will likely have more opinions about what you do with your health than anything else. Did you go to the doctor? What are you eating that? Did you know? Have you heard? Have you tried? It blows my mind. It's kind of funny and it's really obnoxious. But it blows my mind sometimes how a simple comment can spark a full-blown conversation or debate about weight loss or nutrition or what people should or shouldn't be eating or the latest drama in the food industry. And this is why it is essential to get clear on your priorities in regards to health. What are you willing to commit to, even if people think you're totally ridiculous? And what are you not concerned about, no matter how much other people want you to care about it and how much they try to influence you? When you can stand firm in your values, priorities, and goals for your health, you can handle the biggest criticism and judgment without it throwing you off track. When you take ownership of your health and your health choices, it becomes incredibly freeing, and you make decisions based on what you want, based on your goals, not based on how you think people are going to react when you go to a steakhouse and you order salad. Not saying there's anything wrong with steak, because I totally would eat steak. So this week I encourage you to define what healthy means to you, and then determine on a scale of 1 to 10 how important it is that you achieve it. Because you might think that health is this phenomenal, impeccable specimen of a human being, but to you it's like it rates on a scale of 4 because you just don't care. So 1 would mean that you put forth absolutely no effort. If it happens, it happens. If it doesn't, whatever. At 10, it means that you will do whatever it takes to get there, as long as you don't go crazy overboard and become an obsessive weirdo. And doing this simple exercise, making this decision now, will help you start matching your choices with your goals, and then you can let go of any obligation to go with the crowd, and you can do what you want instead of what's trending. So if this episode resonated with you at all, subscribe, leave a review, and keep popping in to get more practical, actionable ways to own your health, own your life, and live with purpose. Take action, stay empowered, and I'll see you next episode.